Chances are you or someone you know has knee pain. Is it you? Could it be someone you know? Either way, by watching this video, you will be able to help yourself or someone that you care about. Let's get started. Today I have with me Dr. Earl. He has been working in emergency medicine for 16 years as a boarded emergency physician. He then went into regenerative medicine for 12 years, allowing him to speak nationally on the subject. How are you today?
Doing great. Thanks for having me.
Good, good. So for today, we're going to be going over tendon and ligament injuries. So what specifically would those classify as?
So ligaments and tendons are slightly different. They form a very common purpose. They help hold things together. So ligaments are the fibrous connection between bones, so bone to bone. Tendons, on the other hand, are connections, they're fibrous connections between our muscles and the bones. Ligaments help keep the structures in line and movable where they're supposed to stay. For example, the knee only moves in a very specific front and back motion because of the structure of the ligaments that hold it together. Then the tendons attach the muscles to certain portions of the bone that allow that knee to move and move on a fulcrum like it does.
And with that being said, with such movement, why would this be such a problem within the knee?
Well, anytime that you have motion that puts the tendons and or ligaments under stress, or with too much stress can actually cause tearing of the tendons and ligaments, that can be extremely painful and lead to dysfunction. Sometimes it just is a matter of the tendons and or ligaments stretching out. Sometimes they tear a little bit, and sometimes there's a complete tear. Again, any of these scenarios really can lead to some significant dysfunction.
Wow, that does sound painful. I guess the next question would be, what would you do in regards to caring for those injuries?
Well, obviously, if you have knee pain that persists longer than just a few weeks, the chances are you need some additional help to get better. So get into a medical professional, get an appropriate diagnosis. The important thing to understand is everything except for a complete tear can have significant healing on its own if it's given the appropriate assistance. Not everything needs to have surgical repair. If it's a complete tear, however, surgery is strongly recommended.
That makes sense. So I guess what could Denali do for such injuries with the tendons and the ligaments?
Well, these tissues, just like all the other tissues in our body, thrive off nutrient and oxygen. And that's what we deliver at Denali. We deliver oxygen and nutrients directly to the area that has the greatest need and bypass inflammation and irritation that may be preventing the body from receiving the nutrients to do its job, the miraculous job of healing.
And how would that compare to some of the other services that are out there to fix such an injury like that?
Well, when you look at getting repair for these type of injuries, again, if you've got a complete tear, surgery is usually highly recommended. After that, you'll hear things like PRP, stem cell, and so forth. Certainly, PRP has some advantages. We use a version of that here, and then we also use Renew-O2. In comparison, stem cell is very expensive and really doesn't have that great of a success rate. It's going to be amazing, but it's not quite there yet. In contrast, Renew-O2, we have a very high success rate in getting these tissues put back together. And I say we, but the reality is it's your body that's the miracle. We just stimulate the healing process with nutrients and oxygen and then precision delivery right where the body needs it. That's the Renew-O2 and Denali difference.
That's amazing. And so how would you know if you qualify for such treatment that Denali could provide?
Yeah, the website is denalimed.com. On there you'll find some additional information about what we do and why. And then you'll find phone numbers if you have some additional questions. Please feel free to give us a call.
That's great. So is this something anybody could consider after that qualification?
Yes, and they can also consider coming in if they've had a surgical repair. We can make the surgery heal faster. And again, I say we're just kickstarting your body's natural, amazing healing process.
That's amazing. Well, I'm surely interested. And again, remind me that website that I can go to again?
It's denalimed.com.
denalimed.com. Well, thank you for joining us, Dr. Brett. So for today's video, I learned a lot in regards to tendon and ligament injuries. I hope you did too. And please feel free to visit Denali Med for more information.